Very good evening, friends. Are you getting my voice? Is it clear?
Clear, sir.
Okay. We will start with today's session. Today we're going to start directly from the chapter of its philosophy. These are the chapters which are included in second.
Not clear, sir. Voice.
Hello.
Not clear.
Hello. 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 Is it clear now?
Now okay, sir.
Yeah.
No, it's okay.
Going to start regarding the 23rd chapter from Kant's philosophy according to the syllabus of second year, and it is uh, because according to the understanding of the aphorisms from the Organon, those are very much necessary, and that's why this clinical part, some semi-practical part, case taking that starts right from this aphorism. So this is the more practical aspect which we're going to learn in this chapter. The chapter's name is the examination of the patient, and he has started directly with the aphorism number 84. But before going into the aphorism number 84 from the Kant's philosophy, I want to add the 83 first from the sixth edition of Organon of Medicine, because once you understand 83, then it has a significance of understanding 84, because the qualities of homeopathic physician for case taking, specifically for chronic case taking, which he has defined in the 83 and which is not included in this chapter. And my suggestion is that always one must learn all those four qualities which Hahnemann have defined in the aphorism number 83 for taking a chronic case, and then we'll start with the Kant's philosophy, the chapter number 23. So my suggestion is to open the sixth edition of Organon of Medicine. First, read the 83 aphorism, and then we'll start directly with the Kant's philosophy. So what Hahnemann defines in 83, this individualizing examination of a case of disease, for which I shall only give in this place general directions, of which the practitioner will bear in mind only what is applicable for each individual case, demands of physician nothing but number one, just write number one, freedom from prejudice, and number two, sound senses, number three, attention in observing, and number four, fidelity in tracing the picture of disease. These are four important qualities the physician should bear. This is what Hahnemann says. For chronic case taking, these are very essential things which one must develop. Some people have it originally, but some people have to develop those qualities. Because freedom from prejudice is not a simple task. It's rather difficult. How to become unprejudiced? Every human being is prejudiced because it is human nature. If you want to become unprejudiced, it is a big task one has to follow. And for that purpose, it is too much important to develop and acquire this quality. My suggestion is that go with each and every case, find it out what patient tells, write it down each and every sentence. Don't even think about what disease he is suffering from. Just go on writing down what the patient details, and whatever the patient is detailing, just write it down, find it out exactly, and at the end, make a totality. Then think about the disease. Even you would have not think about disease, it's okay. Then make a repertorial totality and repertorize that case. After repertorizing, you never become prejudiced. After repertorizing, you get remedies, group of remedies, which are surely very close to the case. And this method generally I used to follow in my practice whenever I'm dealing with any chronic case. I never directly use the medicine. on thematic prescription. I used to repertorize, and because of repertorization, generally whatever is there in prejudiced mind disappears. The clarity comes in our mind, and that is more important. Because what happens whenever we deal with any chronic case, for example, a case of a CA stomach, what happens if you would have treated that case with the Kandurango, next time the same remedy comes in your mind because we deal with the diagnosis. My suggestion is that don't go with diagnosis, just find it out what patient details. Because every patient who is expressing his disease has a different, his own original features. And those you have to find it out. Every patient presents it in a different manner. So Kandirango, if the CA stomach patient with Kandirango comes, he is having very typical cracks at the corners of mouth with severe pain in stomach or basically in epigastric region with vomiting, with bloody vomiting. But those cracks defines very typically the Kandirango over there. If the patient is of acetic acid is there, he is having very severe pain in stomach with a bloody vomiting, but he feels better by lying on abdomen. That is very typical with the acetic acid. So these differences one has to find it out, and this happens when you become unprejudiced, and that is the first quality when one has to acquire. It took long time for me to become or to acquire this quality. But this happens when I started a case, repertorizing each and every case. And that is my suggestion to all of you, that try to repertorize, go through the repertories, find it out what is the characteristic with the patient, find it out whether it is there in the repertory and go for the remedy. Then you will get definitely a good results. So that is first quality, the freedom from prejudice. The second quality which he defines, sound senses. His senses should be sound. Whenever patient is sitting outside, and if you listen over here, the patient is coughing like this. He is coughing like this. Your senses should be so sound that patient who is there in the waiting room, you can catch that and you can find it out successively. So cough in two paroxysms in a quick succession. That is the rubric which you can find it out. So see, if your senses are sound, you are able to catch what the patient is detailing. And many times you get remedies on the basis of that. Patient comes in outside and you listen a big sound. Ask them, I am here. And he is in an arrogant manner, talks with the receptionist. And when he enters in your clinic, in your consulting room, he knocks to, Doctor, may I come in? So the rubric which you catch, that is sound, if you are sound enough at the senses level, you can catch it very easily. You can catch that patient who is patient is behaving like that. He is contemptuous, he is hard for inferior, kind to superior. So that state happens to be there. That state you have catched because you had a sound senses. And those are very important. So these are things which one has to understand. Just a minute. So many times you have to develop such types of extra sound senses. You have to catch the way patient presents. Patient is presenting in front of you through and through, and he is doing this knitting of eyebrows and showing a typical frowning over there. It is you should able to watch and catch. If his face is absolutely greasy, that is more important indication. The only thing is that ask whether he has applied any moisturizer. Confirm that. But these are things which one has to catch. Sound senses always gives you exact idea regarding the patients. And that's why these four qualities one has to develop and one should acquire. The third quality which he mentions is attention in observing, and you should be able to attend patient properly. You go on observing what patient is, how he sits, how he behaves, how he talks, what in what way he gives the reply to your questions. Everything is very important and everything defines the state of the person. And that's why attention in observing is very, very important. And that's why your eyes should be with the patient more than writing it down. You should sit like this and just keep your ear and go on writing and go on watching what the patient, how the patient behaves. Every patient behaves in a different manner. Every patient expresses in a different manner. And that's what you have to catch, because you have to catch a remedy for the patient. You have to catch a rubric of the patient. And that is possible only when you are having this one more quality, that is the very clear observation. And that's why the third quality which he defines is attention in observing. And then lastly, he writes down fourth quality, fidelity in tracing the picture of disease. Fidelity means what? Fidelity is each and every word of the patient. Tanto tantapana. As if whatever his patient is narrating, every word, write it down. There was one of my students who used to write it down each and every sentence. At the same time, he used to make small sketches over there while writing down that this is the expression patient has given. Yes, because of which it becomes quite easy to reach to find it out exact state of the patient. And these are very essential things. These are qualities one has to born and one has to develop. If you develop these qualities, then it is possible to go ahead with the chronic cases and deal with the chronic cases. And that's what he wants to highlight over there in the 83 aphorism. So this aphorism I have purposefully started before going into this chapter number 23, because it was omitted over there in this chapter by Kent, and which has a lot of significance when dealing with the chronic cases. So here completes the 83 aphorism. In fact, it is a big aphorism. We can discuss these 4 points for 4 lectures, different lectures. It has a lot of meaning. But for today, this is sufficient. We'll enter into the chapter number 23, the examination of the patient from Kant's philosophy. And he starts directly with aphorism number 84. And each and every sentence from this aphorism has a meaning. We'll read that aphorism and then we'll learn what the Kant wants to say. The patient details his suffering. So first person who is going to detail his suffering is the patient, from whom you are going to get the case. So patient details his suffering. His persons who are about him relate what he has complained of, how he has behaved himself, and all that they have remarked in him. So first is patient. If patient narrates whatever is there, it's well and good. If patient is not in such a condition, the attendant is the second person from whom you can get all those things. And what you can get from the attendant? Then attendants can narrate what patient's complaints might be. Attendants can narrate what is the patient's behavior or how is the patient's behavior along with them. They will detail exactly the nature of a person, and that's why second important person in the case taking other than patient is the patient's attendant. So how he has behaved himself and all that they have remarked in him. So whatever they want to comment about the patient, they will going to give you details about them. That is the second person is attendant. And then third person who is there, the physician sees, hears, and observes with his other senses whatever they changed or extraordinary in the patient. So third person in the case taking is the patient, physician himself. He will going to hear, he will going to observe, he will find it out what is very typical with the patient, what is extraordinary. The word which he has used is extraordinary. Extraordinary is nothing but the something peculiar, something characteristic, something queer, which you can able to find it out, so that it will become easy for you to reach to the right rubric and right remedy. There was for example, we'll take a simple example. Patient came to me and on one day, and he was having a chronic asthmatic trouble, and he was there at 10 o'clock, and I just started narrating his writing his down case, and I asked what is your education, and he told that he is ME, that is Master Engineer. And when I observed in him, he was wearing the dress code as if a very casual person, a person from a village who used to use the dress, that dress he is wearing. Then just I asked, are you really Emmy? He said, yes. So he asked, why you asked me? No, regarding if you are Emmy, what do you do? I do a job in multinational company. So why you are not wearing? No one looks toward that, doctor. It's not important. It never depends upon you should have quality over here. The way he narrated gives you a remedy. There were two important rubrics which you can catch very easily. So that's the physician's important intelligence comes into play. You have to catch what is that rubric. What is the rubric you can get over there? It is the indifference to the personal appearance. There are two remedies in Kent's repertory. Kent's repertory, there is only one. But in other repertories, there is sulfur and coca. But coca is rather different. Coca is drug remedy. That's why they become indifferent to their personality. Sulfur has their theorizing aspect. They are rat philosophers. So you catch that remedy in the appearance only. That's what the extraordinary thing physician has to catch. This is what he details. This is what he expects. So he says over there, physician sees, hears, and observes with his other senses whatever there is change or extraordinary in the patient. He writes all this down in the very words which the latter and the persons around him make use of. The next point he explains over there, he writes down all this in the very words. Very words. It has a meaning, very words. Whatever the word patient has utilized, you should write it down in the similar words because it has its own meaning. Every person tries to express his own way, and that is individuality. The man behind the symptom is always hidden in those words, the way the patient narrates. So if the patient is narrating like that, he enters in your clinic, he talks. Doctor, I'm bored, really bored. Since last 10 years, I'm taking so many treatments. I'm not getting result. Now I'm there with you. You told me that it will take 6 months. I will I will going to suggest you take 2 years. But please, you do anything for me. Now I will not go anywhere. Everything I'm giving on you. Patient is giving you a remedy which you have to catch. The words which are very important, the state which is very important. What is the state over there? The state is that a patient is narrating in a very mild tone. That is the first important rubric. Then what he says? He says that he has been bored because of lot of treatments which he has consumed. Third important thing which he is detailing over there is that you take 2 years, but you cure me. Carried desires to be carried slowly. Mildness, envy, boredom, carried desires to be carried slowly. Pulsatilla. See, if you are able to catch all those words in a proper way and write it down in a right manner, you can very easily catch all those things. And you can prescribe remedy. And that's why he said over there, he writes all these down in the very words which the latter or the persons around him make use of. He permits them to continue speaking to the end without interruption. Without interruption has very important meaning. Patient starts narrating something and something struck your mind, and you ask any question, the chain of thought which was there with the patient gets disturbed. Most important quality which one has to develop in case taking is keep the patience. Don't go on asking the questions. In fact, form question and just wait what is the reply coming it out, and go on listening. The homeopathic physician should be a very good listener. He goes on listening what patient is narrating and don't interrupt unless and until patient goes off somewhere else. Till that period, he should not interrupt. If the patient is narrating something, just go on writing down in the proper words. He permits them to continue speaking to the end of without interruption. Except is very important. Except where they wander into the useless digressions, taking care of to exhort them at the commencement to speak slowly. Unless and until patient goes somewhere else, if the patient is loquacious and going from one topic to another topic and is getting disturbed over there, then and then only it is your duty to interrupt. Otherwise, don't interrupt. Just go on listening, ask them, yes, start writing down each and every word, and without interrupting, go on listening whatever patient has. And what he says, it takes the time to write it down each and every sentence. So at the start only, when you are dealing with the patient, at the start only, tell them to speak slowly so that you can write down each and every word. See how many minor instructions anyone have given to you. How much minor, but these are very essential. It is your duty to tell the patient, speak slowly so that I can write down each and every word. See, the way he presents is very important. Except where they wander into the useless digressions, taking care to exhort them at the commencement to speak slowly, that he may be enabled to follow them in taking down whatever he deems necessary. So each and every word, whatever the patient narrates, each and every word is important. So this is too important to understand. What the patient expresses, how patient expresses, and your homeopath's duty is that to tell him exactly what he expects from the patient and how the patient should go on, so that he can write down each and every sentence. Whatever is there over here in this book is the aphorisms from the 5th edition. If you open 6th edition, there are certain few more things which he has added. What he said, keeping silence himself. See, keeping silence himself, he allows them to say all they have to say and refrains. Refrains means to avoid from interrupting them unless they wander off to the other matters. The physician advises, exhorts is advises. So words which are changed in 6th edition, exhort, the physician advises them at the beginning of examination to speak slowly in order that he may take down in the writing the important parts of the speaker's say. If you open side by side the 6th edition, you will find it out the easy words which are Hahnemann have utilized, or in fact the Boeing has translated in a proper manner. Because earlier translation was the Dujon's translation, 5th edition, and that was having little bit difficult words which you can get from the 5th edition. So in this aphorism, if you open the 6th edition, the Borik's translation, you will going to get simple words and you can easily catch them. So it is physician duty to advise them to speak slowly so that each and every word they can write it down in a proper manner. So this is the aphorism and philosophy behind this 24 aphorism. He explains in this. We'll start with philosophy in tomorrow's session. We have finished the aphorism. We have finished 2 aphorisms, 83 and 84, and we have started discussing about this 23rd chapter from Kant's philosophy. But today we are there up to the aphorism 84. The philosophy of this aphorism 84 will going to start in tomorrow's session. So that's all for today, and Today evening we'll meet again at 8 o'clock with the new more remedy. One more remedy, that is MacPOS, and we'll discuss the MacPOS in today's session. So that's all for today. Thank you being there, and be there at 8 o'clock, and we'll meet with the MacPOS. Thanks a lot.